Are there organized steps to address the quality of life of sickle cell patients across the board? Or is this catch as catch can? Anybody know of any? I'm sure you have some. But in this country, as a large group of practitioners, do we have an integration for these patients into the system that works for their quality of life?
Well, we can measure their quality of life,
That's
and
not
it's
what I'm
becoming a
to
more
increase
important
access to care? Is that?
Yeah,
I think, I'll tell you, I think in the state of California anyway, up until historically, I think it's been a moral outrage that the adult universities and other major centers have not felt the need to organize and provide the standards necessary for their population. And I think it's been a major issue that now I think it could change, and I think maybe medications will, but it's shocking someone who runs an adult and pediatric facility, the difference in access to specialty care once you leave in a pediatric program. You may have some outstanding adult hematology taken care of who built programs, but if you go outside and you're in the world, most adult patients don't have that kind of access anymore.
It's just shocking with 300,000 or so in the United States. It's just
Oh,
shocking.
it's 100,000 in the United
It's
States.
100,000. You know what? Still shocking.
I mean, there are efforts, and people are thinking about it, about how we develop comprehensive sickle cell programs so that patients have access. And so there's finally some movement in that direction, but we still have a long way to go.
I'm excited that there's significant talk to change this. So there is a community awareness. I'm anxiously waiting to see how it's implemented.
How about we leave it for now as we can do a lot better.
We
have
better.
to do
We can
a lot
always
better.
Have to do a lot
We have
better.
to.
You know, we've come to the end of our time, and before we all go, I want to give each of you an opportunity to give one last thought to our viewers, and we'll start at this end of the table.
Okay. Like Sophie said, we're in an exciting time in terms of sickle cell disease and novel therapies in the pipeline. In order for us to continue to develop that pipeline, we need patients to participate in clinical trials. And I know this audience is primarily clinicians. And I think clinicians need to be mindful of this. And if they're taking care of adults with sickle cell disease or kids with sickle cell disease, and they don't have clinical trials open in their own center, to please refer them to centers so that we can get these studies done.
Gotcha.
Yeah.
You're up.
For me, I would say for patients, be hopeful. This is an exciting time. And for providers, I would say there is a human being behind this request for opioids that you're seeing. So try to see behind the curtain, there's a human being there.
Yeah, I mean, I do think it's an exciting time, and we have all these therapies, but if patients don't have access to care, they're not going to have access to those therapies either.
You've got the last word.
Well, I think sickle cell disease is a unique public health problem. It represents the best of medicine and technology and the worst of the public health system. And I'm hopeful that those two can come together in the future.
Every time I see a patient with sickle cell, I hope it's the last patient that will have to suffer this disease. And what's intriguing and exciting for me is what I've heard here today as we're approaching that. And that's really nice. But I don't take your word lightly. We are not doing a good job in integrating folks from what I've seen, and we can do an awful lot better, and we have to. Well, I want to thank all of you for being here and contributing to this discussion. On behalf of our panel, I want to thank you out there for joining us as well. We hope you found this peer exchange discussion to be useful and informative. I'm Dr. Peter Salgo, and I'll see you next time.